It is week 1 of the Core Connection program. And we are going to start with about a 30-minute breathing class for you. You can do this as often as you'd like. And if you have questions along the way, please feel free to ask them to me in the chat or in the comment section if you're watching this on replay. So what we are going to do is just sit in a comfortable position. The first thing we're going to do is start practicing breathing seated, and then we'll move on. So hopefully you have, 1, figured out if you have diastasis recti, and 2, what your breathing looks like. So are you a chest breather? Are you a belly breather? Are you getting breath into the back? So we want to work on breathing, trying to practice that 360 breathing right here, right now. So just rest your palms on your knees, and we're just going to work on breathing. Breathe in and breathe out. Pay attention to what's happening. What do you feel sensation-wise in your shoulders? Breathe in and breathe out. One more time, breathe in and breathe out. Excellent. From here, we are going to go on to hands and knees. So when you are in hands and knees, we want to make sure that we have this tilted pelvis. You can even roll through this pelvis here. So I am just working through my pelvis, low to mid back. And I'm just going to curl down. So arching it and then tucking it. And when I tuck it, I'm thinking of zipping up from pubic bone to rib cage. Really feel those lower abs working, and then drop it down again and lift. And down and lift. And down, lift. One more time. And lift. Now from here, we're holding it here. Now, if you have diastasis recti, just pay attention, make sure you're not pooching. If you are, you may need to lay down on your back and just kind of relax there and do the opposite of what we're doing here. So really work on firing these lower abs here. And I want you to forcefully breathe out like you are breathing through a straw. So and relax and do it again. Breathe in. Do it again. One more time. Breathe in and breathe out. From here, push back into child's pose. Drop all the way down, letting your chest rest on your knees. From here, we're going to work on breathing here. We're going to breathe in. See how my back is moving? That's what I want you to make sure you're doing. Breathe out. Breathe in. Breathe out. Breathe in. And out. And one more time, breathe in. And out. Relax that head all the way down. Bring those arms in at your side. And then lift those elbows up off the mat. Hold it here. Really think about lengthening through that spine. Elbows and hands are lifted so that they're almost in a 90 degrees. and relax down, bringing those hands up and underneath you. And we're going to drop all the way down onto our belly. From here, we're going to hold our body nice and tight. So it is, when you're in this position, there's a tendency to think about just relaxing that belly into the mat. But because it's the core connection program, I want you to think about lifting that belly button away from the mat so you're really active through the core. From here, we're going to bring our arms up into a Y. Relax that head down. And now we're going to lift. So we're working on strengthening that mid-back muscle. So what we're going to do is we're going to bring, you might be up here. You see how my shoulders are kind of up? I'm going to pull them back. So I'm thinking shoulder blades get placed into the socket. And then from here, we're going to lift up and relax. And lift. And relax. And lift. And relax one more time. Lift from here, bring it into a W. Hold it here. Head is resting on the mat for 4, 3, 2, and 1. Relax down. Roll it over to your side. So on our side, we tend to kind of curl up here. We're going to think about pressing that hip down. We're thinking about stacking those knees one on top of the other and holding here. Now we're going to place our hand on this rib cage. And I want you to breathe in and breathe out, pulling rib cage down. Now, the only time I would say you don't want to do this is if you have a narrow rib cage. So there should be an assessment for you to work through. Continue to hold. Hold on, sorry. And one more time. From here, lay on your back. So continuing with the breathing, we've got our pelvis in neutral. You're going to make sure when you come up, you can look down at your hands, and you're going to have your hands kind of in a diamond shape here, or a triangle shape. And you are going to look and see, are your thumb and your fingertips in the same line? That is what you want. You don't want your pelvis tilted up, and you don't want an arch in that back where your thumbs are higher. So find that neutral. And we're going to start working on heel slides. So these are great exercises to practice if you know you have diastasis recti. What we are going to do is on the push out, we're going to breathe out and then pull back in, breathe in on the way back in. Depending on, hold on. So I'll get you started. Go out and in. And out. And in. So depending on when you do your rib assessment, if you have wide ribs, you are going to practice ha breathing when you press that heel out. So you'll go and in. If you have narrow ribs, you're going to practice breathing through a straw when you press out. 2 more. And you really want to keep this pelvis neutral. Switch sides. We're going to push out and pull back in and press out and pull back in and out and in. And out. And in. 2 more. Press it out. And in. Last one. And in. From here, we're now going to press one side out and in. Don't worry about your breathing. Just find what's natural from this point. But what I want you to focus on is not allowing your hips to rock side to side. So what happens when you bring one heel in, we shift our weight to another hip and then we go out. That is hip stabilization. You shift and out. So it's a little shift, but I don't want that to happen. So keep those hips neutral. One hip bone should not rise up above the other. So just continue here. And this should feel, you should feel when you're doing this drawing up sensation in your pelvis. If you don't, think about that. Think about pulling up, holding your transverse abdominis nice and tight while you do this. Give me 4 more. 4, 3, 2. Last one. Same thing. Now we're going to lift one leg up and bring it back down. When you shift sides, we are not pressing that heel into the floor. Feet should stay soft on the floor while we do this movement. So pretend my hand is underneath your foot and you do not want to squeeze my hand under that foot. So you've got to be really soft, barely touching the mat. And you'll feel how that makes you have to fire on those abs. Keep going. 2 more. From here, lift one leg up and then bring that other leg up to meet it. Woo! Hold it here. Now, some of you may have felt like your back arched when you did that. So we need to work on tucking that tailbone under. Make sure those lower abs fire on, pulling up. So pelvis is tilted just a little bit up. And we're going to bring our knees into 90 degrees. So you can bring your fingertips up towards the ceiling. Or if you really are struggling to keep that back on the mat, you can place your hands under your hips. But I want you to understand that when your hands are under your hips, your hands are doing the work for you. So that's taking away from the core having to work on strengthening it. But I do understand that some of you may be struggling with this. So it is okay to do this until your core gets strong enough. So we're holding here. And I just want you to focus on breathing here. Breathe in and breathe out. When you breathe out, really think about those the lower abdominal muscles. So remember, when you are breathing, your diaphragm and your pelvic floor are working together. So when you breathe in, you should feel the breath going down, tapping that pelvic floor, and then that breath out, pulling the pelvic floor back up, and then breathe out, tap the pelvic floor, and then the pelvic floor responds when you breathe out. Continue to hold. Now what we're going to do is we're going to go heel taps, but don't go where you're going to bend your knee. So we're not dropping a knee down, knee down. We're going to lock that leg in 90 and we're going to slide it down this way and back up and down and up and down. Keep going. Four more. 3, 2, and 1. Relax. Bring those knees in the chest. Rock it side to side. From here, let those legs come down. Now from here, what we're going to do is we're going to think about scooping up. So we want to work on strengthening the glutes and hamstrings here. So we're going to think scoop up. Then we're going to press through those heels and lift up just a little bit. So I'm right here and I'm holding here, okay? So I'm not going to lift up into a full bridge. I'm just hovering here. And here again, I'm thinking about scooping up. Make sure your ribs, this should have your ribs down, nice. They shouldn't be flared up, so your mid-back is on the mat, and you're going to bring your arms up. Hold it here. I want you to pretend like you're squeezing a ball in between your thighs. Hold it. Breathe out, whether you breathe in a ha or through the straw, feeling those lower abs firing on, feeling those glutes firing on. Squeezing those inner thighs towards one another and relax it down. Do that again. Lift it up. We're not going for height here. We're working on more of the strengthening of the core. Yes, glutes are responding, but we're not overdoing it. Tuck that tailbone under just slightly and use that core. Hold it here. From here, we're going to lift one heel up and then the other heel up. One heel and the other. One and the other. 4, 3, 2, and 1. Relax it down. Roll over to the other side. We have to get that other breathing. So I'm going to move, but you could just roll over. So we're here on this other side. And remember, we're thinking about lengthening through that hip. So you're having to use this side. It's not just resting here. We're lengthening, holding. Obliques are having to work to help keep that hip neutral. Make sure those knees are stacked one on top of the other. Place your hand on your rib cage and breathe for me. You may want to, if you feel this in your back, you may want to tuck your knees closer to you, creating almost this pelvic tuck under here. Two more. And last one. And relax. From here, we're going to come back up onto hands and knees. We've got just a couple more things that we're going to do, and then you are finished. So up on hands and knees, always remember you don't want to go to where you're comfortable. So some of you might be comfortable in this arch position. Some of you are more comfortable here. We want to think about lengthening through that spine, tucking that tailbone under just slightly so that our lower abs are active. From here, we're going to bring one leg back. You are going to listen to your body. So some of you may just need to be here or lift up here. You may not want to lift too high. The other thing I want you to pay attention to is we're not lifting our leg up to where our hip lifts up, okay? It's nice and low here. Hold it. And what I want you to do is I want you to connect to those lower abs. I want you to pull them up. So I'm not worried about doing this because I tend to see a flare when we do this. So we're just focusing on those lower and pulling everything up. Think pelvis is pulling up towards without getting rounded, pulling up towards. Hold it for 4, 3, 2, and 1. Relax down. Find your comfort position and then work against it. Lower abs are working. Sorry, we got mosquitoes in here. Gotta get my screen. Hold it here. Bring the other leg back. Hold it. Make sure you don't lift that leg too high. Hold it here. Tuck that tailbone under just slightly. So I'm not tucking here. It's just a little bit to ensure that I'm not here dropping down, right? So really working on that core. Hold it. Remember always that intention equals intensity. So if you are just trying to hold it here and not think about your core working, that's exactly what you're going to get. But if you think about activating that core, activating those hamstrings, you are going to feel your core working more. You've got 4, 3, 2, and 1. Relax it down. Drop back one more time into some back breathing. And then relax. You are finished.